Hello, I'm Linda Rymack-Kohlberg, and I'm a member of the Walnut Creek Homeless Task Force. I've been asked to share information about county, city, and nonprofit services available to homeless and at-risk individuals as a prelude to the live via Zoom community forum on homelessness in Walnut Creek that immediately follows this video. You'll also find this video on the Walnut Creek Homeless Task Force website at www.wchomelesstaskforce.org. I'll introduce you to 7 organizations that offer extensive quality of life and life-saving services to homeless individuals and families. These organizations are also resources for individuals and businesses who would like information about homeless services and who have concerns for people in need with whom they engage. Highlighted will be Contra Costa Health, Housing, and Homeless Services, CORE, Coordinated Outreach, Referral, and Engagement, the City of Walnut Creek Community Development Housing Programs, HOP, Walnut Creek Police Department's Homeless Outreach Program, Trinity Center, Loaves and Fishes, and the Walnut Creek Homeless Task Force. As the slides come up on the screen, you'll see the key services provided by that organization and the contact information either at the top or the bottom of the screen. The Health, Housing, and Homeless Services Division of Contra Costa Health Services integrates housing and homeless services across our health systems and coordinates housing and homeless services across county government and the community. The Coordinated Outreach, Referral, and Engagement Program, CORE, works to engage and stabilize homeless individuals living outside through consistent outreach to facilitate and deliver health and basic needs services and secure permanent housing. The City of Walnut Creek, working in partnership with the community, is committed to enhancing our quality of life. We are a community meeting tomorrow's needs while protecting the quality and character we value today. The Walnut Creek Police Department protects and serves the community through professional conduct and proactive enforcement of the law. The Walnut Creek Police Department's Homeless Outreach Program, HOP, is a dedicated team of 2 officers who address both quality of life and public safety issues surrounding homelessness in Walnut Creek, offering referrals to shelters and mental health services to those in need. Trinity Center is a doorway to opportunity, providing essential safety net services and a pathway forward for vulnerable populations. Trinity Center advocates for those who are seeking housing, financial stability, and wellness. The mission of Loaves and Fishes of Contra Costa is to provide community-based food programs and partner services that focus on basic needs. Mindful of the needs of the Walnut Creek community and the city's quality of life, the Walnut Creek Homeless Task Force seeks compassionate solutions to homelessness and works with local and regional organizations to develop safety net services and the means for affordable, supportive housing. To view the November 2021 Community Forum on Homelessness in Walnut Creek, please visit the Walnut Creek Homeless Task Force website at www.wchomelesstaskforce.org. Thank you for joining us.
Good evening, everyone, and welcome to the Community Forum on Homelessness in Walnut Creek. My name is Mark Newsom. I'm co-facilitator for the Walnut Creek Homeless Task Force, and I'm going to be your moderator for this evening's session. Let's start out this evening by taking a look at the agenda. Well, first, I hope everyone had an opportunity to watch the video that was playing before this session, introducing the service organizations. And if you did not, this video will be available on the website, which we will post in the Q&A chat after the meeting. The first on the agenda, we will have introduction of the panelists who are with us this evening. And we will go through that. Donna Colombo from Walnut Creek Homeless Task Force, Leslie Gleason, Executive Director of Trinity Center, Lisa Thomas from CORE, Coordinator Outreach, Referral and Engagement, Jamie Jeanette, Community Engagement Specialist for Contra Costa County, Jeanette Kennedy, Loaves and Fishes of Contra Costa. Next slide, please. Sergeant Gary Silva from the Walnut Creek Police Department and the HOP team, and Mark Wardlaw, Community Development Director for Walnut Creek. Following those introductions, we're going to have opening remarks from Mayor Kevin Wilk of Walnut Creek. And following that, we will have a presentation from Michael Mayette, Mental Health Program Manager at Contra Costa County, and Lisa Thomas from CORE. Following that, we'll have questions and answers, which we will field from everyone, and we'll discuss that at the end of that time. So, if we may, let's go ahead and introduce the panelists, and I'll start with Donna Colombo.
Good evening. I'm Donna Colombo, and I am the co-facilitator for the Walnut Creek Homeless Task Force, and I'm also the chair of the Housing and Shelter Committee.
Thank you, Donna. Leslie?
There we go. It wouldn't be Zoom without some glitch, right? It's my great pleasure to be with everybody tonight as we look at this really important topic of the intersection between mental health and homelessness, because it puts people at risk of being able to keep their housing, obtain necessary services, and regain housing. So we're glad to be with everybody tonight.
Thank you, Leslie. Lisa Thomas, would you like to go?
Hello, my name is Lisa Thomas, and I'm one of the coordinators for CORE Mobile Outreach Team, a program that's part of Contra Costa Health, Housing, and Homelessness Service.
Thank you. Next, we have Jamie.
Hi, everyone. I'm Jamie Jeanette. I'm with Health, Housing, and Homeless Services, and I am the Community Engagement Specialist, and I can answer sort of big picture questions about what's happening on homelessness in the county today.
Thank you, Jamie. We also have Jeanette Kennedy from Loaves and Fishes of Contra Costa.
Good evening, Jeanette Kennedy, the Development Director at Loaves and Fishes of Contra Costa, as well as a resident of Walnut Creek.
Thank you. Next, we have Sergeant Silva. Sergeant Silva is having some technical difficulty with the video. And Sergeant Silva also represents the HOP team. Next, we have Mark Wardlaw.
Hello, I'm Mark Wardlaw. I'm the Director of Community Development with the City of Walnut Creek, and I'm very happy to be here representing the city and its housing and homeless services provided through community development.
Thank you, Mark. Next on the agenda, we'll have remarks from Mayor Kevin Wilk.
Good evening. I'm Walnut Creek Mayor Kevin Wilk, and I want to first say thank you to Linda for sharing that overview into the range of services and programs available in our community. As mayor, I'm proud of the leadership role that the city is taking to address the challenges and needs for our unhoused residents. It's key to remember that these people are homeless for a variety of reasons, often not of their own choosing, and there is no one-size-fits-all solution, nor are the solutions quick or easy. But these individuals are proud of our community, and I'm heartened by the joint city, county, and nonprofit collaboration underway to provide compassionate approaches to improving their conditions. It was back in 2017 that Walnut Creek set up our Homeless Services Fund to pay for operation of programs at the Trinity Center and the Winter Shelter. We've increased our support for the core team, and as COVID restrictions ease, our police department's Homeless Outreach Patrol is back at work. You're going to hear from a panel of experts this evening who are dedicated resources, their time, and their creativeness, and their thought to put our unhoused community into safe housing. I want to thank everyone here tonight sharing their expertise, as well as thanking each of you who's watching on Zoom. Your input and participation in these initiatives shows the kind of supporting and caring community we all know Walnut Creek to be. And now, on to our community forum.
Thank you very much, Mayor. Next on the agenda, we're going to go to Michael Mayette and Lisa Thomas for their presentation, so I'll turn it over to them.
I'm the mental health program manager with Healthcare for the Homeless. It's a interdisciplinary mental health team through public health. And I was just going to describe a little bit of that program, how we're in the community, and how we're supporting folks with homelessness throughout the county, and of course in Walnut Creek specifically. And I'm going to pull up a bit of a presentation here so you can see our team. I hope everybody can see it. And this is Healthcare for the Homeless. And again, my name's Mike. And so just big picture of what we do. Like I said, we're a multidisciplinary medical team. And our mission is to improve the health of the homeless population in Contra, Costa County by increasing access to health care and by providing a team-oriented approach to healthcare that focuses on harm reduction and integration of behavioral and medical services. So who we serve, Healthcare for the Homeless provides health services to all adults, children, families who meet the federal definition of homelessness. And what's great is that through our funding, we can see pretty much anybody, whether they have insurance or don't have insurance, they are undocumented or citizens, it doesn't matter. We have an open door policy. And generally what we try to focus on, the HUD definition is a pretty broad one. And we really focus on the hardest to serve folks, the street homeless, and people who are really system disenfranchised in general. This is a look at our team. Again, we're a multidisciplinary team. You see a little photo of a fraction of our team. We're relatively small. We're about 30 people or so, but it's a mixture. So we have the medical providers, the doctors, and the nurse practitioners, the mental health clinical specialists. I myself am one. We have dentists and dental assistants, registered nurses, public health nurses, community health workers, and health educators. And the whole idea is that we try to bring all the services at once to kind of break down these barriers. I mean, most of our folks we encounter have had a lot of system trauma, a little bit distrustful. So a big part of our engagement is around rapport building and creating that kind of initial relationship to kind of bring folks back into the fold of the system and allow them to access all the great services that they can get once they feel more comfortable and connected. As far as the Healthcare for the Homeless mental health services specifically, on our team, we have 5 licensed mental health clinicians. And they're kind of scattered about in different parts of the county and different types of engagement situations. One of the main ones is in the shelters. We work with H3 in some of the county shelters. We work with Trinity. We work with the Bear Rescue Mission. Really any shelter that would like our support, we try to connect with. In the county shelters, we have people who are kind of embedded in there a few days a week. And so they work really closely with staff, and especially with CORE, which Lisa will speak to more. And then ambulatory clinics. We go into the county health centers, Antioch Health Center, West County Health Center, Martinez, and we kind of blend in. And so we'll just be in a regular clinic, and we'll have our practitioners and our staff and our folks be coming in. And it's a great way of getting folks from perhaps on the street, and they meet us in the van and outreach, and then we get them into the clinic, and they have familiar faces, and then they get used to coming into the clinic and that sort of thing to develop that trust. And then working down from structure, we have our mobile vans, and I'll get some pictures of them later. But they're these really big buses. Maybe you've seen them. They're kind of mobile clinics, and they're really great. So we can kind of put them at various parts of the county and provide pretty robust support for folks for both medical and mental health. So on those vans, we would have a medical provider. We'd also have a mental health provider, both on each side. And then we would have nurse and a CHW doing registration. So it's really a fully functioning clinic. And the whole idea is that they're coming on board and they're getting their whole health needs met. And so they have their medical needs and their mental health needs because they're all kind of connected. And that's kind of the beautiful thing. And then we have our field-based work. And a really big part of that, Lisa will be talking more about that, is our relationship with CORE. And we do outreach days, and we have a smaller van, which is still kind of a well-developed clinic van. It's just a lot smaller. It's one of those Sprinter vans where it's much more mobile, and we can go out and be more just more mobile. We can go meet people where they're at, different encampments, and wherever people might be. And so we can kind of bring the services to them. And that's really one of those really great entry points for developing those relationships and helping people connect to the system. And then as far as mental health staff goes, they'll work individually. They will go into the community away from the clinic. They'll develop their own relationships with folks, and they do some clinical case management. So they'll go into the field and meet people wherever, kind of meet them where they're at. We'll meet them in encampments. We'll meet them under bridges. We'll meet them at the coffee shop, whatever's needed. So there's a lot of flexibility there. So sometimes we're embedded in the clinic setting. Sometimes they're moving freely to maintain those relationships and connections. As far as referrals go, generally it works. The vans are kind of the honey. And so people come and connect, and we'll often get warm handoffs. People come in for medical support, and we'll get warm handoffs from our provider. CORE is a big connection for us, people who have identified mental health needs, and we'll try to get them to the van to get the mental health needs met. And then, of course, when we're in the shelters, we can get lots of referrals when people arrive, and we try to touch folks when they first arrive in the shelters, just to kind of get a sense of their needs are, if they're connected to the system, if they need to connect to mental health, just to kind of get a pulse on folks. And as far as the services go, we're pretty broad. I like to think of my staff as kind of the Swiss Army knife. They can do all sorts of different things. So they can do the mental health assessments as it's needed. They can do brief therapy. They can do clinical case management. And they also run groups. And then, of course, connection to that larger system, referral connection to specialty mental health, to the ambulatory behaviorists, which generally do more mild to moderate therapy in the ambulatory setting. And then, of course, the other part of behavioral health, AOD services. And we do some of that through our medication supported treatment, but also connecting to residential treatment for alcohol and drug and that sort of thing. So a little bit about our approach. I kind of mentioning some of these words before, that therapeutic clinical case management model. It's kind of a catch-all. You really got to meet the client where they're at. And so sometimes we're in the more therapy mode and in the more like working on interventions. Sometimes we're in the more case management mode. And sometimes people just need that extra support to get to that next thing. So maybe they have anxiety, so we have to treat the anxiety so they feel okay going into the clinic or even coming onto the van or talking to whoever. So they're always sort of intertwined. And our staff kind of prides itself on being able to kind of like see the need and kind of meet them where they're at. And that initial phase is usually kind of the outreach phase, that rapport building. People are really system disconnected and kind of mistrustful, and they kind of got to kind of earn that trust. And so we do a lot of due diligence to make a lot of touches. Even if people are a little hesitant at first, we'll kind of keep going back out and try to make those connections. And then once they do sort of connect, we can kind of work again, into that brief therapy, into that case management support is needed, and then connection to that larger behavioral health services, that really robust entity in behavioral health for folks who are a little more functional, who can make it into the clinic and kind of do those extra steps. And sometimes it might take a while. It might take, sometimes we can connect them within a week. Sometimes it takes months or even years to kind of get that larger connection. That's ultimately the goal, but oftentimes the reality is people are kind of in that ambivalence and they're having a hard time, and we're trying to help them kind of get to that next stage of change to feel more stable. And as I mentioned, I kind of touched on this a little bit, but just around the lifestyle, the challenges around this, the AOD issues, the alcohol and drug issues, and the past negative experiences with the system, that ambivalence, that stop and go engagement. And so generally, we, as healthcare professionals, kind of just try to provide that open door policy, often provide longer term therapeutic case management for support for consumers with these challenges with a larger system. So I think this is the outreach team. So that's one of our small vans for the outreach team. This is kind of that initial point of the spear. We'll go out into the community and we do a whole slew of services, even in that little van. We do chronic disease management, we do addiction treatment, injection kits, Narcan, we do wound care, we do point of contact treatments like HIV and other supports. We do the mental health therapy and case management linkage. We'll have when we generally go out with outreach team, again, there'll be a provider, there'll be a nurse, a CHW registration person, and a mental health clinician. And this team really works in conjunction with CORE when Lisa talks more about it, but we usually pair up and go out together and kind of utilize and leverage our different relationships and different support services. We do STI screenings, we do medication management support, actually that first touch. A lot of people are connected to the system and they might even have a primary care provider. They just maybe not even know them. And so our goal is to kind of get them a little stabilized and maybe connect them to their PCP or their primary care provider. And then of course, linkage to services, CalFresh, all sorts of good stuff. And at the bottom, you can see that was the different members of the team that go out: the provider, the clinician, the nurse, community health worker, and of course, the CORE outreach team. That's one of our big buses. This is kind of the mobile clinics I was talking about that we park throughout the county. And again, there are 2 provider rooms on the van so they can get their medical treatment done and also have a mental health space to meet for their clinical case management or their therapy in connection to care to the larger mental health system. And then generally those are fixed sites that are planned, they're regular each week, so they're predictable. Unlike the smaller van, which kind of moves around, I think of it like a bit of an ice cream truck that kind of goes around and tries to get interest and connection. And these are some of the sites we have throughout the county. We have one at Walnut Creek. We've often been connected with Trinity Center. And then we're in West County, we're in Central, we're in East County. And the sites might shift depending on need. A lot of the folks move around, the encampments move around. And so we try to be sensitive to it and try to figure out good places for people to feel really connected and kind of be that honey. So we want to find those bees out there. And then of course, in the ambulatory services, we're in the clinics themselves. Like I was saying before, we kind of embed in there. And then once people are a little more stable, they're a little more functional, they can get into the clinic, they'll have familiar faces they can see. And then of course the shelters, these are 2 of the county shelters where we have folks dedicated to many days a week. And we're about to open a new shelter in East County at the old Motel 6, East County shelter. And we have a new clinic there. So we're going to provide a lot of consistent care there as well. So we're really excited about that. And then we also there's a respite shelter at the Concord Health Shelter, or at the Concord shelter itself. It's kind of co-located. And the Healthcare for the Homeless team runs that. And it's a 26 bed that may be shifting now with the COVID, but it's for medically vulnerable folks, often step down from the hospital. And we do a variety of services, stabilize to compensated illness. We do the mental health stabilization, rehabilitation. We do the brief therapy, just like we do in the other clinics, connecting to mental care, connect to the larger behavioral health system, and other connection supports. And then, of course, we have the medication-assisted treatment for folks who have addiction. And so there's a program called Choosing Change that does a very robust version of this, and we have our own kind of smaller version dedicated to providing Suboxone to folks with opioid addiction in the community. And all of our providers are trained, and so they can go out and do that. It's a great kind of first connection step. And then eventually, once they kind of stabilize, we try to graduate them up into the Choosing Change program if they feel stable enough to do so. And in that, they have a lot of group work that they can do with other folks going through. It's a kind of peer space, and it's a really nice supportive connection. This is some information about us. This is our main line, and we have a dental line and our medication assisted treatment line, and of course 211, which will connect you to CORE and all sorts of other great resources. Thanks so much. We're going to pass it off to Lisa.
Hi, everyone. I'm Lisa. I'm the CORE Outreach Coordinator. You want to go to the next slide? So CORE stands for Coordinated Outreach, Referral, and Engagement. And our mission is to engage, stabilize homeless individuals living outside throughout the county. We have currently 13 teams. Next slide. We have 13 teams. Walnut Creek has their own team, as well as 2 county teams, west and east, a county night team who are the referral and placement for the warming center in Concord. The Pittsburgh team, Public Works and Creeks, they work in Walnut Creek and Rodeo and Richmond and other areas where there are homeless in the creeks to help clean up the trash area and get the people out of the creeks before the floods happen. We have a TAY team that is just for 18 to 24, and that comes with a social worker as well. We have a CalWorks team that works with EHSD and the families there who are on CalWorks. They are the referral source for Housing Works, which is a housing and rapid rehousing for families. There's a Richmond San Pablo team, a BART team, a Martinez Pleasant Hill team, a Concord team, and an HDAP team, which is having to do with homeless disability advocacy program, which helps people who are on GA that has a pending SSI application to help stabilize them in affordable housing until their SSI is granted. Next slide. We are the 3 access points into coordinated entry by connecting with 211 or going to a care center in Concord or in Richmond and Trinity Center. Then they will reach out to CORE, and CORE will try to refer them to any of the services that they qualify for, which is like the family shelters, the county shelters, GA, Trinity, the crisis centers. We also connect them with healthcare for the homeless and AOT, and as well as mental health care centers. Next slide. Michael.
For some reason it's thinking. 1 second.
Sorry. Well, we could talk some more about, we also are the referral source to get into the Project Room Key, which is still available at the Marriott. Oh, here we go. CORE also creates a mobile front door to services. We do direct placements into shelter, linkage to mental health and behavioral health. We provide transportation when needed. We provide a fee waiver for IDs at DMV. We also help assist connecting them with benefits, which is GA, CalWorks, CalFresh, getting them connected with a Social Security advocate to help them do their SSI. And we are also the main source of encampment and abatement support. So if a city or an area is getting ready to abate, they contact CORE first, and we go out there to see if we can relocate the clients so that they don't end up losing their stuff or get in trouble. Next slide. We do continuous training with the use of evidence-based practices like motivational interview, housing first model, harm reduction model, low barrier shelter programs, nonviolent crisis interventions, conflict meditation, and Narcan and first aid training. We are also getting a self-defense training so that we can care for ourselves as well as other people when we're out there in the field. Next slide. So the warming center is now open. It only has 6 beds at the Concord Service Center. The Concord and Respite shelters. The Concord shelter is referred by CORE. So you call 211, you touch base with a CORE dispatch. CORE dispatch will then dispatch you to the proper team. The team will go engage with you. And if you are vaccinated and there is a bed available, CORE will do their best to try to place you. They are also going to be the placement team for the Brookside shelter when they open, as well as assisting Trinity with their armory. Concord and Walnut Creek used to share a team, and now they are separate. So Walnut Creek has a team that's just devoted to them. Next slide. And then there's a whole referral service. So basically, you know, we get calls from social workers at the hospital, healthcare for the homeless, AOT, AOD, Trinity Center, and they touch base with CORE first, and then CORE will send a team out to engage with them and find out what their necessities are, whether it's shelter, referral to housing or benefits. CORE will start the process and do the initial referral. Next slide. Sorry. So sorry. Okay. We have also been connected with helping people during this time of COVID. We work with Healthcare for the Homeless to not only get them tested, but provide them. We go out with them Tuesday, Wednesdays, and Thursdays, and Fridays they are in Martinez at our Martinez showers. We provide connect with them to help them get wound care and vaccines and any type of COVID relief that they need. We also work with other agencies like Shelter Inc., Catholic Charities, and the HUMS program to get them the COVID assistance they need in case they are, you know, out of work due to COVID and unable to pay certain kinds of bills. Next slide. This is our way to get to CORE. So you call 211, or you can go to one of the service stations with Walnut Creek, Richmond, or the Concord one. You call 211, press option 3. You'll get a dispatch operator who will then take your information and your contact information and then relay it to the proper team. Next slide. And that is it. Michael Callanan is our program manager. There is me. I'm Lisa Thomas is one of the coordinators, and then there's a Robert Preston and Hillary Bowers who are also coordinators. And we enjoy working with all the teams and agencies that we work with.
Great.
Thank you.
Thank you, Michael and Lisa, for those great presentations. At this point in the meeting, we're going to have questions and answers. Please submit your questions through the Q&A chat. Meredith will field them and pass them along to me, and I'll try and pose them as we go. So we have some questions already, and Michael, the first one, perhaps you could field: is there information available about people becoming mentally ill as a result of homelessness?
Would you like me to take that, Mark?
Yeah, sure. The question is there information available about whether people become mentally ill as a result of traumatic homelessness, et cetera?
Oh, that's a great question. Yes. I mean, a big part of our work is work in trauma. And so losing your home, losing that stability, and trauma is an injury of safety fundamentally, whether you're getting hit by a car or in a war or you're suddenly homeless and your whole underpinning is kind of gone. And when you think about how good it feels to go home and to kind of shut your door and that kind of feeling, if that's gone and that floor is gone, that really activates the system. And that prolonged and over time, the body will shift and sort of adapt to that. And so when you think of like trauma and like mental health as part of that, that can lead to all sorts of anxiety. It's basically an anxiety issue, but can lead to depression. It can lead to all sorts of mental health issues that are pretty severe. And then what often happens is there's coping along with it, especially when you're homeless, often leads into maybe substance abuse around survival. So you have trauma, you have a lot of survival issues that come up. You're kind of hypervigilant, you're nervous. It's dangerous. They're real threats. And then just the trauma itself, you get very nervous. And then that leads into secondary coping issues around AOD, alcohol and drugs, and that becomes a problem in itself. So maybe you start using some meth to stay awake because you're nervous what's going on. Before you know it, maybe you've done some fentanyl in there, or you're just addicted to the meth, or now you have a bit of an opioid thing going on, and then it all pivots to that. And so it just starts to swirl. And so I just kind of painted a little bit of a picture. Not everybody goes through that, but that's one trajectory and just how it can add to that. And oftentimes if people already have some symptoms that maybe are controlled, it can activate it. It's a big life stressor. And so it'll kick up any underlying issues that are going on already and just destabilize a little bit.
Great. Thank you, Michael. Next question, perhaps Mayor Wilk could speak to this. What is the city's budget for homeless services, and do you anticipate that going up next year?
Maybe I'll take a stab at that. In terms of, this is Mark Wardlaw. In terms of our overall city budget, we have a couple of programs that are funded through our grant programs. Our total kind of community grant funding is about $770,000 per year through our social services, infrastructure, public facilities, and economic development funds that we receive. And then focused on crisis intervention and homeless services grant funding. That program is about $270,000. And then some of our other operation costs are just funded through our staffing, through police department, through community development work, and then some of the work through public works and in their support of community cleanups and public right-of-way and creek drainages.
Thank you. Here's a question maybe Sergeant Silva could speak to. Is it illegal to be homeless in Walnut Creek?
The clear-cut answer is no.
Okay. Thank you. Here's a question that several of the panelists might want to address. Is there a change in the number of individuals seeking homeless services in Walnut Creek? Let's start perhaps with you, Leslie.
Hello. Yes, we at Trinity Center are absolutely seeing an increase in numbers. We used to have an average of 50, maybe 60 people coming to see us every day for their basic services. Now it's at least 65, and some days we're topping 80. That's a lot of people and a lot of growth coming from the community, people who need access to meals, to showers, to laundry, to security, and to the basic case management we can provide to help them move out of their current situation. So yes, we are definitely seeing an increase at Trinity Center.
Okay, thank you. Perhaps, Lisa, you could also comment to that?
Yeah, the Walnut Creek team has been seeing newly homeless, like new homeless, not repeat attendants over there at Trinity. They have been engaging with at least 5 to 7 new people, every other week. They seem to see a lot more of the elderly and a lot more families, and connecting them with services. A lot of mental health clients too are reaching out to Trinity now that they weren't doing before.
Okay, thank you. And Lisa, and perhaps you could speak to this one also. Is there a card or a brochure that can be passed out to people who need assistance?
Yeah, CORE has a flyer that we pass out, and I think Jamie, the county also has one.
Okay, great. And Leslie, does your team also have such a card?
We do not currently, although we have in the past, and we're talking about having another one so that concerned community members, like everybody on this call, can at least put something in the hand of someone that they're concerned about and say, hey, go to 1888 Trinity Avenue, call 211, connect with the system of care that we're creating to provide not only emergency services, but wraparound services to help people get back on a pathway forward.
Okay, thank you. Next question, Donna, maybe you could speak to this one. Is there a resource to enable churches and other organizations to connect people and services?
So the question is there a resource to help churches connect?
Is there a resource to enable church organizations and other private organizations to connect with other services?
So one of the organizations that is faith-based is the Multi-Faith Action Coalition, and they work with the faith communities, and they have a number of committees just like the task force does. So that would be probably the primary. They're also aware of the county services and make referrals that way. I know at Trinity, when I was, and I'm sure Leslie does this too, is that make sure that each of the offices have information on how to connect people, because people do walk through. I mean, a church is a place of safety. And so if they can't find Trinity, although it's pretty easy to find now, but they can find the church and they will walk through those doors and ask for help. So yes. And then plus there is 211 that can also help connect people.
Great, thank you, Donna. Next question, maybe Sergeant Silva, you could speak to this. Is data available about how many individual encampments abatements have been conducted in 2021?
As far as 2021 goes, we have not done the point in time count yet. So hopefully we're going to do that again this coming year. So I don't have the numbers on that right now.
Okay, thank you. Not exactly sure. Perhaps, Donna, you could start with this question. Is there data available about how many people in Walnut Creek have been placed in some type of permanent housing?
So that might be a combination of people to answer that question. Leslie might be a good place to start. One of the hardest things for most services that try to help people find housing is there just isn't a lot available. Yeah. And that's why the county programs with the Project Room Key and Project Home Key are so important, and the shelter services are so important, because there just is not a lot of housing that people can afford. And so that's why we have this network of services to try to help. Leslie, do you have any kind of sense of how many folks have been placed this year? Jamie, you might be able to answer as well.
Well, of course, one of the great accomplishments of your tenure, Donna, has been building this building that you see photographs of. That did create a permanent affordable housing for almost about 44 households. But once you get people in, they try like heck. They do everything they can to stay in that housing. So it doesn't create opportunities for the next wave of people experiencing homelessness. So yes, there have been successes in Walnut Creek, and that's due to a lot of community support and our political leadership. And the rest of it during COVID has been person by person by person. Rental property owners opening their doors, rental communities saying, yes, we'll take a chance. And that is also part of our coordinated entry system of care. We don't do it alone at Trinity Center. We help connect people to the resources that can help them find affordable and permanent housing. And in the meantime, we're a place of safety for them.
One thing I wanted to add, so we have, I don't have the data sort of at my fingertips about how many people have been housed in Walnut Creek. What we do have is data actually from 2020 where we asked people where they were last had housing, and at least 186 people that have accessed homeless services were Walnut Creek residents at some point. They last had stable housing. So we can tell that, and there's probably a way that we could pull the data to see where people are housed, but I don't have that at my fingertips.
Yeah, it's also Mark Wardlaw. You may the city has housing programs as well, assistance programs. You're on, yeah.
Yes, we do. We have actually the city has a very progressive affordable housing program, and to date there's about 550 affordable rental units in the city, and I don't think that we're tracking their point of origin from their placement. We also have about 108 units, rentable units, that are in the pipeline of processing and in the process of securing funding. And the city is financially participating through loans and grants in many of these particular projects. The city also has some very progressive programs and is, I think, a leader in the state in terms of affordable housing programs that include inclusionary housing, funding requirements, commercial linkage fees, new construction and acquisition programs. And I think an interesting project to talk about is a partnership that's now with Grace Presbyterian and the Homeless Task Force and a couple of other partners to explore a very low income housing type of project that has very small homes. And the city's expressed its interest in having that come through a conditional use process, permit process with the Planning Commission. So from the city's role, I think the city's done quite a bit to advance housing opportunities for a broad diversity of people.
I think at this point, it's just, we need more. We just need more. There's a lot of people out there that are looking, and they just don't have enough income to be able to afford the current rents, even when they are listed as affordable. So we have to be, as a community, very creative. And we welcome, just a plug for the task force. The task force on homelessness meets monthly, and we work in committees. And so if yours is an area that you're passionate about, like for instance, trash disposal, there's a committee for you. If you're interested in working on micro homes, tiny homes, there's a committee for you. And we like to leverage the expertise of the community, the energy of the community. This is a very involved city. I've been very pleased to be working with the city over the last 10 years. And we've made a lot of progress, but we need more people. And so if you are interested in getting involved, come on the first Wednesday of the month, except for December, which is the second Wednesday of the month. And you can visit our website to find the calendar and the Zoom. It is virtual. It's at 2:00. And then a lot of the committees meet outside of that time to do the actual work and report. We also have many speakers come because part of our goal is to research best practices around homeless services and solutions. And so there are cities that are doing wonderful things. So we invite directors of various programs around us to come and talk to the community about what they're doing and how it's working. So we'd like to leverage the expertise of the community beyond Walnut Creek. So Jamie's always at our meetings. The connection with the county is very important. And so that's a plug for the task force. And we do these forums once a year. And then we also have a website, and we try to provide as much information as we can.
Thank you. Thank you, Donna. Next question, Michael. Is there information on how many people have mental illness when they become homeless? So how many people are mentally ill when they go into a state of being unhoused?
That's an interesting question. I don't have any specific numbers on that. What we do is track our contacts and then the number of times we touch folks and people who meet that diagnosis. So we can get a sense of like how many folks are in need based on kind of who's asking for help. It's hard to know. A lot of people are out there who just don't want to engage with us. So the actual numbers of like how many there are out there, we can make some guesstimates. I don't have the numbers in front of me either around that, but we definitely use, and Core does a lot, and the sergeant mentioned the point in time count to get a sense of the whole picture. And then we try to use the contacts we have. And then also in the EHR, the electronic health record, in the county, there's some flags that if people are at risk or have had homelessness or kind of meet that definition, there's some data around that.
Yeah, I have
so
some
we can
data,
kind
actually.
of put some numbers together to get a sense of it. Go for it, Jamie.
I actually have it. So from our 2020 annual report, and I'll just add, these are self-reported, so some folks may not be disclosing this, but basically of all the people that accessed homeless services in Contra Costa in 2020, it was about 9,700 people. About 53% of all those people had a disabling condition. And of those people, the most common disability were mental health conditions. So that was about 2,800 people. What that's telling you is how many people have a mental health diagnosis that is disabling. So like, I would say like, I have anxiety, depression, it's not disabling. So they wouldn't fall into that category. But it does give you sort of a thumbnail sketch of what we know from people that access services in 2020.
Okay, great. Thank you. Thank you both for that. Thank you all for that. The next question, maybe Sergeant Silva, is another question about abatements. Maybe you could address. Is there information about the number of abatements in 2019 or 2020 that were conducted?
Again, I don't have the numbers for abatements.
Okay.
I can tell you that when we first started the homeless outreach program in the police department, we were doing a couple a week, anywhere from very small to very extravagant encampments. Then COVID hit, so we were pretty much told not to do anything. Then we were short-staffed, so we weren't out there being quite as aggressive. So I don't have the actual number, but they are, most of the ones that we had gotten rid of are back. So we're still working on that. Yeah. But I don't have an exact number for you. I'm sorry.
Okay, thank you. Donna, maybe you could speak to this one. What was the nighttime sleepover program at St. John Vianney successful, and will other churches?
And then Leslie can finish it. So
okay.
When we started the nighttime, the overnight parking at St. John Vianney, we had 6 to 8 participants per night. It was successful in the fact that there were no incidents in the community. We were successful in raising enough funds to cover, I think it was almost a year. We found that when the winter shelter opened at the Armory, that people wanted to be inside rather than their cars, and I can't say I blame them. So, but COVID affected it big time because the church said we can't open the facility now to people. So Leslie, maybe you want to, I don't know the status, but I know it ended because of COVID.
Thank you, Donna. That's exactly right. We do consider it a success. We consider it an important part of the toolkit for our community to address homelessness. At Trinity Center, we feel like if we need a location, we could go forward. We have the model, we have the success rate, and we want to go forward. Okay. It's not always easy to find a place that will work for. But we do consider it successful. And moreover, Warm Winter Nights, who operates a sheltering program for families, does have a safe parking program out in Pittsburgh. And they are not only full, but they have a waiting list. So we know that in the absence of permanent housing, at least a safe place to sleep overnight is critical to people, to allow them to feel safe, take care of their basic needs, and go to work each day. That was actually something we found from our safe parking program. The people who used it consistently were people who were then getting up, washing up in the bathroom, and going to work, and trying desperately to make ends meet. So yes, there is still a need. It's a successful model. We'd love to do more of it.
Right. And I guess the other part of that question was, will other churches be encouraged, other churches or faith-based organizations be encouraged to participate in the same kind of model?
We certainly hope so. I think there is a fear that if you allow 6 to 8 people to park in your parking lot, that there will be 100 that come. And, Leslie and I can tell you that just doesn't happen. Yeah. If you have a process and you have good guidelines and you have good management, that just does not happen. I do think that it is more temporary than some of the other ones because people come, they don't know where they can park, and it's not safe in various neighborhoods. And so it might be much shorter term than, say, the winter shelter or the county shelter for some folks. So it's kind of a stepping stone. And that was when we started it, that was our hope, that it was just to be able to give people a leg up so they could find something more stable.
Okay, great. Thank you for that. The next question, I think, Jeanette, is about Loaves and Fishes of Contra Costa. And the question is, does Loaves and Fishes serve only homeless, unhoused individuals or others as well?
That's a good question. Loaves and Fishes is open to anyone. So we primarily serve very low to low income folks as well as homeless, but anyone in need of food is welcome to visit any of our 5 dining rooms, including our Walnut Creek dining room in the Trinity Center in Walnut Creek.
Okay, great. Thank you, Jeanette.
Mm-hmm.
I guess the next question is, the next question, perhaps, Mike, you could address. Does your team serve only homeless individuals or county patients who can't come in for services?
Great question. Yeah, our team, they have to meet the definition of homelessness to receive our services. It's a really broad definition. So most people can probably meet that. I think the one caveat would be like you have a rent or you have like a lease or a mortgage. So it's a really broad definition. So we're a pretty open door. So yeah, we're very accessible to folks. We try to lower as many barriers as possible and try to help meet their needs.
Okay, thank you, Mike.
I will just add one thing, which is that the public health has other mobile clinics that are for more general populations. So Mike's team is specifically for people experiencing homelessness, but there are mobile public health and clinic resources in the community.
Great, thank you. Next question, perhaps several people could respond to, but the question is, has there been an increase in the number of specifically senior homeless individuals? And if so, is there any sense of what the cause of that situation is? So perhaps I don't know, perhaps Lisa, could you speak to that first?
Yeah, so there's been an extremely high raise in elderly being out there homeless. We see just that the cause of this is their spouse passes and they're not able to, pay the rent now because, they were working off that Social Security as well. They're getting foreclosed on. Their family aren't able to take care of them anymore. There's like all kinds of different reasons, but it's I'm saying at least 5 to 6 people every single day are newly seniors being found, in an encampment in front of a building, squatting in front of their old house that got foreclosed on, and it's just extremely high.
Yeah, we actually saw a 50% increase from 2018 to 2021 of people over the age of 62 accessing our services.
And at Trinity Center, we're seeing the older people come in. We have for a couple of years now, but they're coming in also with multiple health issues, as you might imagine, physical health and mental health issues that remain unaddressed and complicate their ability to just manage everyday life.
Thank you. Mark, perhaps this question could start with you. If kicking homeless people out of encampments just moves them from one place to another, why should we take that action?
I'll answer it kind of indirectly first. So, as said in the beginning of this program, there's no very clear and direct solution to this problem. It requires partnership between local agencies, communities, non-governmental, church, religious, all of the people that you see here to come up and put together the puzzle pieces. In terms of encampments, there are other issues that go with homelessness. In fact, in many of our creek drainages, some of the impacts that result from encampments, debris and waste actually result in water quality infractions. And then so we have to clean up and comply with the regional water quality control board requirements. Public health is an issue, and certainly public safety is an issue. And I don't think the solution is to push people to the next jurisdiction, and that's certainly not our intent. There are rights that go with supporting people, so it is complex, but there are also other factors to consider as well.
Thank you,
I can
Mark.
touch on that just for a second too.
Sure.
So what we try to encourage them to do is to have a small encampment tent place to go sleep, somewhere undercover if there's no warming center open or a place for them to go. The only time we eradicate these encampments is when they're riddled with trash, soiled clothing, feces, needles, bike parts, other stuff that they don't need in their encampment. So, and like he was talking about down the creeks and stuff too, that they it all does run down into the water because they usually do camp by creeks. The other ones that are in the park that are camping there for a couple of days, they leave their garbage. There's usually feces by the front door. Those are the encampments that we're moving along. The ones that are clean and pick up in the morning and go, we don't bother with those. So the main reason for us picking up encampments or cleaning up encampments is for the reasons that I stated.
Thank you. The next question relates to a program for people with ongoing medication needs. Is the county health program able to support ongoing medication needs for unhoused people? Mike, maybe you could start with that. Does your program do that?
For sure, yeah. It's a big part of what we do with healthcare for the homeless, both in the field and also in the shelters, working closely with the county shelters and with Trinity. A lot of folks, we're kind of that initial step, and if they're on medications and they want to do some kind of med reconciliation or they need refills or that sort of thing, we're always available to kind of put those in and to kind of connect them back to the system. And then if they're somewhat disconnected maybe from their primary care provider, we try to get them back in for appointments. So yeah, that's a big part of what we do, for sure.
Thank you. The next question is, what is the most effective way that a Contra Costa resident can contribute to helping organizations which assist homeless people?
Just, Jamie, I can just note that we actually have compiled a list of agencies that are seeking volunteers as well as agencies that are seeking donations. And we have both those lists. There's probably at least 20 agencies on there. We have those lists on our website, and I think I dropped it in an answer in the Q&A.
Great, thank you. Donna, did you have a comment on that? What is the most effective way a Contra Costa person can contribute to organizations that assist homeless people?
Do something, anything. So, I think there are a lot of volunteer positions. If you're truly interested, one way is to come to the Walnut Creek Task Force and find out a little bit more. Visit our website, visit the county website, visit the service agencies. There are a lot of them. It can be very, very, one small thing, just show up. It can be saying hello. One of the things that is very heartbreaking is that people who are living on the street or homeless feel invisible. They're avoided, people walk around them, people are afraid of them, and they don't talk to them. So places like Trinity Center provide the opportunity for community. It's really heartbreaking. And so a smile and saying hello, do you need help, goes a long, long way. And if they say no, say, okay, have a good day, move on. But so I think just find a passion, find something, talk to Leslie, talk to the various organizations that we presented tonight and ask them, do they need volunteers? What do you need and how can I help you? And it can be a very small thing or it could be a big thing like building a building, but we don't have to go there. So I hope that answered that question. Just something. Anything.
Donna,
Yep. And thank you, Donna. It's true. Any kind of gift, whether of time or your expertise or your involvement, makes a huge difference. We are at Trinity Center getting ready to reopen our volunteer connections. COVID kind of put a dark line in that. But we want people to come see what we do, see the value that we create in the community and for the community to create community and to create a pathway forward for people. So please stay on top of our website. And if you're interested in anything more particular, financial or time involvement, please reach out to me.
So Trinity Center has a, sorry to jump on you, Jeanette. Trinity Center has an annual Thanksgiving meal. And next Wednesday they have, and it's a beautiful event. And think about that. If you're homeless, you may not have, you be able to visit your family, or they may not even know where you are. And so Trinity provides, and the volunteers and the local churches, I think there are about 8 local churches that are involved with Trinity. And there's Rotary groups, all kinds of groups that help. And so if those are the kinds of things that they could use help with too, or you could just show up and smile and have lunch with someone.
I was just going to chime in with Leslie and Donna and just echo what they're saying. Loaves and Fishes welcomes volunteers. We welcome people getting involved in our mission. We are a small staff, but only as mighty as all the volunteers who contribute to help us deliver the upwards of 1,500 meals that we're delivering in one day throughout all 5 dining rooms. So please visit our website, and there's lots of opportunities to get involved in our organization as well. So thank you.
Great, thank you. Donna, there was another question for you. Could you speak to the need for more people to rent a room through Project Front Door?
I don't think that's for me.
I'm sorry.
Project Front Door? Project Room Key?
Yeah, I'm sorry. It just says specifically to ask you this question. I'm sorry.
Jamie, can you answer that? I'm not the one to answer that one.
Yeah, I don't know if that's about Project Room Key. I can just do a really quick plug about that. So at the beginning of the pandemic, we needed to move everybody out of congregate shelter. So the state put forward a bunch of money for communities to move people into hotels as a way to have some physical distancing. And that project has been called Project Room Key. We have now 2 hotels that are still operating and for people experiencing homelessness. And we also have some rooms for people that are maybe housed but need to isolate if they are potentially waiting for COVID results. But the majority are for people experiencing homelessness. And the folks in those hotels are prioritized for housing resources because we know those hotels won't be funded forever. So the folks that are moved into the hotels, it's really prioritized by vulnerability. And then they're prioritized for permanent housing. So we're trying to create some flow, but now some of the other shelters are back open. So it's a little bit less of a tight pinch, but we do have the hotels operating as well as some of our regular shelters. And just to clarify, they're not renting rooms through there. So it's like a shelter. It's basically free. But they are getting support to get into their own types of housing where they may be paying rent.
Okay, thank you very much. The next question, Officer Silva, maybe you could or Sergeant Silva, excuse me, maybe you can answer this question. Can the HOP officer or core agencies share a success story?
Sure. We had one individual prior to COVID that we were dealing with who was addicted to heroin, and we kept arresting him until finally he decided he wanted our help, and we ended up driving him to Richmond because the county health bus happened to be in Richmond that day. And then from there we took him to the hospital in Martinez to get his prescription filled for his Suboxone, and then he ended up getting clean. I haven't seen him since, which is a good thing, I think. We haven't had any reoccurring issues with him. So that was a good success story for us. We stayed on him until he finally took the hand that we were reaching out for him, and I think he's still doing a good job. He's still staying well.
Thank you, Sergeant. And Lisa, did you have a success story you could share?
Yeah, we have a few. We have been locating people who in Walnut Creek who weren't willing to go into shelter or Project Room Key in the beginning, who have now a couple of them, including a family, have been placed at Project Room Key, who are about to get housed through BACS, and then the couple that we have placed at the Concord shelter are about to get put into shared housing. So we're accommodating as many as we can in the shelter and at the hotels. Rooms don't come available on a daily, but as soon as one comes in, when Walnut Creek has a vulnerable person who fits the criteria, we try to place them that day.
Great. Thank you very much. Here's a question. If someone sleeps on your property overnight, what should you do to help them? And Lisa, maybe you could speak to that first, if you would.
I think you would suggest to have them call 211 and have a core team engage with them. If it's in the morning, our first team, our Walnut Creek team starts at 7. So, getting them connected so that we could assist them. Maybe they just need a bus ticket home, or maybe they need a phone so they can contact a family or a relative, or maybe they need the warming center for the night. A 211 would be the best option for you to start with.
Okay, thank you.
I would also say that if they're in Walnut Creek, refer them to Trinity Center, especially for a hot cup of coffee in the morning. There are many local restaurants that also do help people who are homeless by making coffee available, or a muffin or something. But I think my 211 or Trinity, and just ask them if they're okay. How can you help?
Okay.
Although I'd like to say, if you sense this isn't a person you can approach, then don't. So, I think everyone has a sixth sense about whether this person is approachable or not, but it doesn't hurt to say, hello, can I help you? And then you will quickly gauge whether you should engage, you can spend a little more time with this person, or you need to call for help.
And just to piggyback off that, it doesn't have to be the client. You could call 211 yourself. and tell them, hey, I have a homeless person out in front of my house, so I think might need some assistance, and then we'll go engage without knowing who it is or anything to that point.
Yeah, I had a person call me from, I think it was on the planning commission, and he said, I walk by this guy every day. He's sleeping on the bench. I walk by him every day. What should I do? I said, ask him if he's okay, number one, and then does he know about Trinity Center? And if you have a cup of coffee in your hand, offer it. So I think people want to help, they just don't know how. Yeah. And that's why we do these forums. That's why we have the task force, is to be able to make all of the services known to the community.
Right. Thank you. Jamie, I'm not sure, maybe you could speak to this, but what are the income requirements to qualify for low-cost housing or affordable housing?
That's such a great question, because the answer is it completely depends. I almost feel like the term affordable housing doesn't mean anything anymore. There was a point in my life where I was working at the county, and I have a master's degree and had a union job, and I still was qualifying for free tax prep because I wasn't making enough. So I was like technically considered low income. Most of the folks that we are serving really are in that extremely low and very low income bracket, and there's not very much housing that is available in that bracket. And so one of the things I saw in one of the other questions was like, what can we advocate for? When communities are building affordable housing, they really, really need to look at and make sure they're prioritizing housing specifically for extremely low and very low income communities. That is going to touch homelessness, or especially touch the most vulnerable people that really have no income, that have really significant disabilities, that are never going to be able to even pay. Honestly, a lot of the, like, what we would consider affordable is like, it might as well cost $1 million. There's no way that they're going to be able to afford it. So it really depends. So that's something that communities can do and people can advocate for, is really specifically targeting and naming that extremely and very low income housing and making sure the subsidies are there to support that.
Great. Thank you very much. Lisa and Leslie, I'll start with you, Lisa, but what hours are support available at 211?
So CORE's 211. So there's the 211 crisis line, which I think is available 24 hours. And in CORE dispatch, we're available from 7 in the morning. Our first team arrives, and our last team leaves at midnight.
Great, thank you. And Leslie?
And Trinity Center is open Monday through Friday, 8 to 4, 8 a.m. to 4 p.m. We serve breakfast. Throughout the day, we have access to showers, laundry, mail, storage, computers, and then we close at 4.
Great, thank you. Are any of these organizations, I imagine the organization, what's intended as the organizations on the line here, are any of these organizations accepting things like blankets and coats? Trinity, Leslie?
Sure, yep. We have a great partnership with White Pony Express that not only works to salvage food resources through the community, but clothing resources. So our clothing room, which is open daily to meet the needs of our members and anybody else, is largely stocked by White Pony Express. So that would be our first suggestion. Contact White Pony Express, connect with them, because if you have something to offer that can't necessarily be used at Trinity Center, it can go to other places in the community that can use it. In addition to that, we have a wish list, which you'll find on our website, that will tell you what we need currently. We dedicated our space to people, not storage, so we don't have a lot of storage space. So everything we ask for is very seasonal, very needed in the moment. Yes, we are approaching the winter season where blankets and coats and extra warm weather gear are needed. So please keep an eye on our website to find out how you can meet those specific needs. But overall, we suggest people connect with White Pony Express for that. Thank you.
Yeah, and I'll chime in. That's the same for Loaves and Fishes. We, our mission is to provide food. So that's what we focus on, but we do meet people who have other needs, and we do partner with White Pony Express. They do come out with a winter boutique, and they provide our guests with things that are needed that they can provide. So unfortunately, we cannot accept them, but please do research White Pony Express.
Okay, great. Thank you very much. And on the topic of donations, here's a question. It's, is there still a need for donated cars?
Well, if you visit our website, Loaves and Fishes, we do accept donated cars. We take them, and there's an organization that processes it and sells it, and then we receive a donation. So we would certainly accept any donated cars. Thank you.
Great, thank you. A question about overnight parking programs, and the question is, do these programs allow RVs?
For the one that we operated in Walnut Creek, for the period of time that we did, no, RVs were not permitted. We went through an extensive public process to allow us to be able to do that at St. John Vianney, and it did not include RVs. However, I do know in Berkeley, they've got a really successful program starting up with basically an RV park right next to an otherwise sanctioned shelter program. So that need is out there, but it wasn't what we were able to do with our safe parking program in Walnut Creek.
Okay, thank you very much. And we still have time for more questions, so please feel free to submit questions. Question perhaps for you, Mark. How much does it cost the city of Walnut Creek to house a homeless person? I guess that's an average they're looking for.
Mm-hmm. I don't think that's a question I can answer because we don't actually have agency provided housing. So I might ask maybe the county.
Yeah, I mean, it's a great question, and I don't think that we have a definitive answer. Partly because I think it totally depends on what services the person needs, how long they're experiencing homelessness, what kind of housing they get into, what their subsidy looks like. I don't think there's an easy answer. What I can say is that we do know that the faster we can get people into housing, the less expensive they will be. And I don't like talking about people as an expense, but basically the longer somebody is experiencing homelessness, the more likely they are to have trauma, mental health challenges, physical health challenges. It's really hard to hold down a job. It's, as you know, you've heard described, like people are living in a car and washing up. It's hard to maintain all of those things. So the faster we can get people housed, the less expensive it will be. Also, we've seen reductions in interactions with the criminal justice system. Basically, all of those systems are going to see less interactions with people once they are stably housed and getting their needs met.
Yeah, I'd like to echo that. It was shortly after St. Paul's Commons opened, and I was walking by, and I was hailed by one of the lucky Trinity members that got an apartment, and she said, "Oh, Donna, oh my gosh, all of my health problems have disappeared. I can cook for myself. I have nutritious foods. I can shower. I can do my laundry." She goes, "I didn't know all this was caused because I didn't have a home." So homelessness affects health, physical health, as well as mental health, addictions, everything. And once the person is housed, and the hospitals, the ER rooms are filled with people who don't necessarily need a doctor, they need a place to live. So it's a huge impact, and the housing makes such a difference. So go out there and build housing, for Pete's sakes. Extremely affordable housing.
Yeah. Right, thank you. There's one fairly broad-reaching question that several of you probably will want to opine on. For those advocating structural change, what issues should we be pushing our elected officials to focus upon? Looking at the local, state, city levels.
I'll jump in there. As you've heard, definitely need more actual bricks and mortar homes that are accessible and available and individualized for people. And we need the supportive services to go along with that. Our members have suffered a lot of trauma through their journey in being unhoused. And it's not always like, here's the key, you're good now, right? They need to relearn how to live in community, how to keep up with the terms of their lease, how to keep a place the way that we would want our friends and neighbors and loved ones to live. So there's not only permanent housing, but with supportive services in some case. And yes, that adds to the price tag. But after you've worked so hard to get back into housing, don't you want to throw everything you can at it to make sure people never become homeless again? So those are some of the bellwether points we want to make to elected officials and our financiers. We need bricks and mortar with the supportive services in many cases.
And streamline the process, please. It takes years to get to the point where you're breaking ground because of all the processes. It seems to be, in my experience, that each city is different in terms of how they process applications for housing, and then what the process is to get it through design review and approval and all of that, plus built. So as an example, we're building, I hope, 160 very affordable units in Brentwood with Eden Housing. And I've been working for that on 2 years, for 2 years now, and we are nowhere near breaking ground. So elected officials, advocates for affordable housing, we need to do something to shorten the process and to shorten the fees and get this housing built.
The other thing I'll add is at the state and federal level. So, exactly what Leslie said of like, we really need these different types of housing. But one of the challenges is right now there's a lot of one-time funding. So there's the state is like, here's a big pile of money, spend it really fast, and then it's gone. And the kinds of programs that we're talking about for people to have ongoing rental support and supportive services requires sustained funding. And it's not sexy, but that's really what's needed. So these one-time bursts of money are great. So like you could buy a building, but then how are you going to pay for the support services and how are you going to pay for the rent? So I think that is one of the key things. And I think a lot of folks have been telling the state, like, we're really, really grateful. Don't get us wrong. This is amazing. But like, it needs to be ongoing or be able to spend out over a longer period of time, or we can't, it's not fair to build things and then kick people out, or how, trying to cobble together, especially for crisis response services like shelters and stuff. HUD doesn't fund any of that. So shelters really have to cobble together a bunch of things. And I think that's part of why the Project Room Key stuff has been so revolutionary, because it was like this big infusion of funding basically for shelter, but it still is time limited.
Thank you. Michael, with respect to mental health, what are the key issues that we should be pushing our public officials to focus upon?
Yeah, I just want to echo what everyone was saying. We think about the nature of trauma, we think about like the experience of homelessness and these kind of subtle steps that it takes to get stabilized. And someone was mentioning just like the amount of time and effort it takes to finally get to that housing. There's so much system work that's gone into that. It's such a huge investment of time and resource. And it's not like, I think Jamie was saying, like you give them the key and it's done. It's just not. Like you have to kind of surround them. And so much of that is mental health support, it's social support, it's kind of case management, it's kind of independent living skills, but it's that sustained support. And yeah, we can't emphasize that enough, that the low tier Jamie was talking about, that just needs a lot of wraparound support. That's the biggest gap we run into, for sure.
Okay, thank you. Here's a question. What resources are available to a community when debris is left in their area by unhoused people?
What resources are available to the community?
Yeah.
What should people do? We usually come out and take care of that. We work with Public Works directly and schedule cleanups for any debris that's left over from any kind of encampments. We also go around and pick up shopping carts that are full of soiled clothing, which we dispose of, and then return the carts back to the businesses. But as far as debris left behind from encampments, we always take care of that.
Okay. So I imagine that would relate to a HOA also.
HOA is a little bit different. I'm not sure how that works. They would have to, excuse me, get a hold of their HOA association
Okay.
and find out if there's some way they want to have a dumpster brought in and they can have a community meeting and pick up themselves.
Okay. Great. Thank you. Okay, we're almost out of time. Are micro homes meant to be transitional or permanent housing? Donna, do you want to speak to that?
So if you're talking about the potential for microhome village at Grace, that is not transitional, it's permanent supportive housing. They're very small homes, so are they meant to be forever? No, but there's no time limit when they stay, and there is case management to help people move into larger homes when they become available. But the situation that we've all talked about is that there's just very little available for people who are on have such small income levels. So if you talk about tiny homes, cottage homes, micro homes, pallet homes, depending on the project, they can be transitional, but the one in Walnut Creek is not.
Okay. Thank you. We have time for one more question, and Mark, maybe you could address this. What is the fiscal 2022 budget for homeless services?
The numbers that I talked about earlier are grant funding numbers, which were from our grant sources of 770,000 and then 270,000 focused on the crisis intervention and homeless services grant funding program. That is our current budget, and we have a 2-year budget with the city. So the 21-22 and 22-23 are established.
Well, in closing, I want to thank everyone for participating in this forum. I think it was very successful, and really appreciate Mike, Lisa, Mayor Wilk, and all of your participation. And thank you very much. If you would like, please check out the Walnut Creek Homeless Task Force for this material from this evening. You can review it at that time, and you can also see when our meetings are and other associated information. So thank you everyone for participating, and have a good evening.
And thank you, Mark.
You bet.